In 1969, we put a man on the moon and brought him back. In 1969, surgeons were using chisels and hammers in the operating room in orthopedics. Fast forward, there was a big movement in improving our tools. We were more accurate in putting the implants in, but we weren't seeing this dramatic improvement in terms of patient functionality and satisfaction. With the conformance implants, to recreate patient anatomy, try to get the kinematics better. So this is the first major improvement that we've had in 50 years of knee replacement design. Everything else has been incremental. This is the conceptually new design based upon patient desire and functional outcome goals. Hugely important. The customized knee replacement, some of the things that we've moved away from compared to off-the-shelf traditional knee replacements have to do with recreation of shape and fit, of course. The shape of everybody's knee is unique. There's no doubt about it. So anything that we can do to get closer to the kinematic profile of an individual patient's knee is really important if you're going to have any hope of achieving some of those functional goals that patients want to achieve. Now, off-the-shelf implants, frequently, 20-25% of the time, you're in between sizes. If you have to upsize the implant, that worsens the problem. It exacerbates the possibility of having overhang, as translated into a higher rate of pain as well as residual stiffness. To downsize the implant to avoid overhang, now you've reintroduced a new problem of raising the joint line and possibly getting midflexion instability. With the conformist total knee implants, you're still not getting the overhang or the underhang. So it's a virtually eliminated problem. So that issue of the surgeon having to make an intraoperative decision, should I make it bigger, should I make it smaller, it doesn't exist anymore. One of the long-term problems we've had with knee replacements has been the short-term recovery. So if you get off to a bad start, you never get the flexibility or the confidence in your knee that you were looking for to begin with from a patient's perspective. I think one of the things that we've seen early on is that recovery of range of motion. The pain and the residual stiffness and swelling that you typically get from a knee replacement operation just isn't there anymore. Early on, the patient is saying, it really feels good. They're going to push themselves to achieve more. And I think that's what we're seeing with the conformist implants. The patients are so stable right from the get-go that they trust the knee. And so they go to town on their physical therapy. Patients are coming from further and further away because they're hearing about the customized knee. I mean, you get customized clothes, you get to tailor your car, you make your kitchen the way you want it. Why do I have to go with a knee replacement that has a 40-year-old technology? That doesn't make any sense to me at all as a patient. So that's one thing that they're hearing. Then they're hearing stories of how well patients are doing early on, and so they're coming specifically for that. I mean, they're coming in asking for the customized knee replacement.
I met Dr. Sinha, and he showed me the knee, he showed me the piece, he explained everything. And it's interesting because with this knee, there's no clicking, it's just a regular knee. And when you have a good surgeon like he is, anybody that would do something else would be missing out. Dr. Sinha saw me a few days ago, and he saw the range of motion, and he said, just wait, it'll be even better, which is hard for me to believe. I don't know how much better it can be, quite frankly.
We're starting to see patients who are coming back and they're asking me specifically, can I do this, can I do that? Whereas I never heard patients ask about those things for a year or 2 years after surgery. Now I'm hearing it at 3 months, 6 weeks. With conformists, we're at the cusp of a dawning of a new orthopedic age.